So is your horse's fat creating metabolic issues, or is there metabolic dysfunction making your horse fat? Because I think we're oversimplifying EMS in horses. Most conversations still focused almost entirely on sugar, starch, body weight, caloric intake, and energy burned. But newer research in humans is looking at fat tissue very differently, not just as stored energy, but as biologically active tissue that can influence things like inflammation, hormones, and insulin sensitivity throughout the body. And honestly, I think this opens up a much bigger conversation in horses too. Because if fat tissue is metabolically active, then equine metabolic syndrome may be far more complex than simply your horse needs to eat less starch or move more. In human metabolic syndrome research, scientists are now looking at something called adipose tissue insulin resistance, meaning the fat tissue itself may become metabolically dysfunctional. And when that happens, the adipose tissue may start producing inflammatory signaling molecules and altered hormone signals that can further worsen insulin resistance and metabolic dysfunction throughout the entire body. So instead of fat simply being the result of metabolic dysfunction, it may also start contributing to the problem itself. And that creates a much more complicated physiological cycle because inflammation can worsen insulin sensitivity. Insulin dysregulation can promote more fat storage, and excess adipose tissue, fat, may increase inflammatory signaling. Stress hormones like cortisol can influence blood sugar and fat deposition. Mitochondrial dysfunction may reduce metabolic flexibility and energy efficiency. Loss of muscle mass and conditioning changes how glucose is utilized throughout the body. Now, obviously, horses are not humans, but I think these physiological themes are important to start paying attention to in the horses too, because EMS may involve inflammatory pathways, endocrine signaling, stress physiology, adipose tissue dysfunction, muscle metabolism, mitochondrial health, and overall metabolic resistance. I know that's a mouthful, but I think that's a much bigger conversation than simply feed low starch and exercise more and hope for the best.